SMARTool is a European Commission-funded research project targeting to the management of coronary heart disease. More specifically, SMARTool aims to carry out a multidisciplinary approach involving cardiologists, clinical imaging experts, biologists, chemists, policymakers, engineers, health economists, data mining experts, and bioinformaticians. Multi-scale and multi-levels models will integrate these data to obtain a cardiovascular disease stratification model for diagnosis, cardiovascular disease progression prediction model for prognosis, and a cardiovascular disease treatment model for therapeutical interventional treatment. Now we will demonstrate a use case scenario for the management of CHD patient using SMARTool tools and decision support systems. Mario, a 62-year-old man facing with a new appointment at his drug company, refers to his wife to complain from a couple of weeks of transient chest pain occurring at rest, seldomly on effort. For this reason, they decide to book a visit to the cardiologist, Dr. Neglia. After viewing the blood tests, which show mild hypercholesterolemia 235, and having measured arterial blood pressure quite high, 150/90, Dr. Neglia calls Dr. Parodi in order to discuss about Mario's condition. Dr. Neglia calculates a Framingham score of 9, a low to mild risk to develop coronary artery disease within the next years. 20%. To rule out coronary artery disease, he invites Mario to undergo ECG effort stress test, which is performed the day after. At peak exercise, the ECG shows ascendant ST segment depression of 1.2 mm in V4 to V6 leads, not associated to symptoms. Beyond standard blood tests results, the results of the SMARTool stratification algorithm obtained by using additional molecular markers selected in SMARTool as best predictors from genomics, transcriptomics and lipidomics, and tested by lab-on-chip, strongly suggest a higher risk of CAD than that associated to FRS, and thus support the indication of an imaging test. The intermediate likelihood of coronary disease strongly supports the indication of an imaging test, and coronary computed tomography angiography, CCTA, is the option won by Dr. Neglia because of the high specificity of negative CCTA and the possibility to run CCTA images within SMARTool platform. As a matter of fact, this computer platform combines patient-specific molecular information with functional assessment of coronary plaque propension to progress, offering a comprehensive risk scoring system able to outperform current models of CAD diagnosis and prognosis. Within 1 week, Mario undergoes blood sampling for molecular and gene variant examinations. The CCTA is quickly presented on the laptop of the doctor for clinical evaluation, simultaneously with the prognostic assessment by the SMARTool platform. According to the CTA analysis, there has been found a non-calcific lesion, around 50% diameter lumen reduction of proximal left circumflex artery. Differently from the Framingham score, ECG stress test and morphological features of CCTA, local and systemic features collected into the CDSS of SMARTool reveal Mario as a high-risk patient with high likelihood of circumflex lesion to quickly progress toward a critical stenosis. More specifically, the CCTA imaging of the patient is used for the 3D reconstruction of the LCX coronary artery, where its 50% lumen reduction is assessed. The 3D reconstructed segment is used for computational modeling based on finite elements. The purpose is to provide decision support to the expert. This is achieved first by calculating the computational SMART FFR index, which is highly correlated with the invasive FFR. The computational results of FFR calculation show an FFR 0.80 of target lesion with low local shear stress. Moreover, plaque growth modelling is implemented and simulated for the LCX coronary artery of Mario in order to predict the plaque progression. This simulation is based on the modelling of the major mechanisms of plaque growth, including blood flow, lipids transfer, inflammation, foam cells formation, and plaque formation. In the final step of the computational simulations, stenting simulation for an optimal setup of a coronary revascularization is implemented in order to provide treatment decision support to the expert. The experts, after the evaluation of the clinical status of Mario and his computational results, Mario is invited to undergo percutaneous coronary angiography and revascularization of the coronary lesion. The procedure of patient stratification, risk assessment and management in SMARTool is easy for the doctor, but also for the patient. In particular, the medical experts are provided with computational tools and systems for the easier and more accurate decision support for the treatment and diagnosis requiring the minimum user interaction and added operation time. On the other hand, patients are positioned in the center of the SMARTool concept, providing patient-specific diagnosis and treatment based on regular blood examinations and state-of-the-art computational modelling. SMARTool strategies contribute to the evolution of the current practices for the coronary heart disease based on validated algorithms and methodologies using a large number of human cases of eVinci population.